Well, hi there. My name is Wolfgang Babisch. I'm working for the Federal Environmental Agency in Germany in the Department of Environmental Hygiene, and my primary field of interest is effects of noise.
So this is Dr. Wolfgang Babisch, and if you start reading up on your noise research, your name keeps popping up in the literature. What made you so interested in the subject of noise? Can you give us a little tour where it all started?
Well, actually, it happened accidentally. When at university I studied environmental engineering, and with special emphasis on acoustics and on air pollution. And the first place of work that I applied for was the German Federal Health Office. And at that time, a person was working there, his name was Ising, who was very much engaged in noise effects. And I became a member of his team. And I was fascinated about what was going on there. The group carried out laboratory experiments where we exposed subjects and measured several health outcomes, blood pressure, stress hormones and so on. And I was pretty much attracted. Then I started reading the literature, what else was going on in that field. And then I had the great opportunity of becoming a partner in a big health cardiovascular survey which was carried out in 2 communities in the United Kingdom, in Caerphilly and Bristol, and it was my duty to assess the noise exposure of the subjects, and I also analyzed the data. The fascinating thing is bringing together the information which is obtained from the engineers about the noise exposure, and I sometimes call the doctors also engineers. They assess the health, because it's a pretty boring job doing the same thing in thousands of people. And putting both information together, this is what we call epidemiology and medical statistics, and drawing conclusions from the association. This is the real fascinating thing. And since then I stayed in that business, working on noise effect. Not all the time. There was also a period of maybe 10 years or a bit less where I was also working in the field of respiratory effects of air pollutants in children. So, but my main subject has become the noise.
So during your career, where you have actually really researched the subject of noise, what are the most important findings, would you say?
Yeah, it started with these studies which are carried out in the UK, because there we were investigating real hard endpoints like cardiovascular events, myocardial infarction. And also we had a lot of blood pressure, blood data available, so we could show that classical risk factors for cardiovascular diseases such as glucose levels and blood clotting, the viscosity of the blood and cholesterol levels, blood lipids were also associated with the noise. With the noise. And then we started carrying out studies in my own hometown in Berlin on the association between the incidence of myocardial infarction and noise, and we were able to repeat the findings from the UK. And then we started publishing about these things, and this is how the story started, if one can say it like this. And since then, many more studies appeared from researchers all over the world. The most research has been carried out in the Netherlands, in my country, and in Scandinavia, particularly in Sweden, with respect to different noise sources. Road traffic noise was always in the center of research, and also aircraft noise, because many people that live in the vicinity of airports complain about the noise, and we of course also wanted to know whether it does them any harm in terms of manifest health effects.
And is the noise problems, is it a global issue, or is it very much a European issue?
I would say it is a global issue. though most research has been carried out in Europe, but certainly people in the US are very much interested in this research because the economic situation is very much the same. And if we think about the so-called developing countries in Far East, in Asia, Bangkok, Hong Kong, the noise levels in these cities are even much higher than the noise levels that we do have here in Europe. On the other hand, these people have to deal maybe with problems which they think are much more urgent than ours. But definitely the results that we obtain from European studies also refer to the noise in these countries.
What are the current trends in noise research?
Well, if we look at the history, that is a quite nice story. We started with experiments in the laboratory where we exposed subjects and we found immediate reaction on the circular system and on the stress hormones. And then as a consequence of this, we developed a hypothesis how noise could affect health, and the basic mechanism that we consider is the stress mechanism. And the next question then was, well, what does happen to the people if they are exposed for years and years? And this is when epidemiology came into the game. We do have a lot of studies available, and current research goes into the direction of assessing the combined effects of noise with other stressors. One of those stressors can be air pollutants, and this is very normal at the moment. So we try to assess first to disentangle the effects, to see how much of the effect is due to the noise, how much of the effect is due to the air pollutant, and what is the risk of people that are exposed to high levels of both.
When policymakers look at your data, is there any particular things that they should take note of?
Any particular thing in the data? Well, policy makers, they want to quantify the risk of environmental agent or whatever, and so they want to see dose response curves or exposure response curves. So this is the most important part at the moment, that we would like to see the slope of the association and the onset, at which noise level at the bottom end does the risk increase. And once such dose effect curves are established, then we can use them for the quantification of risk, actually to estimate how many additional cases do we have to expect from the noise in this case.
I just listened to a presentation that you gave, and you were saying that you're not so into the economics of noise or the economical implications of noise, but do you have any kind of comment on this economical impact of noise and noise policy?
Well, that's not my particular field of research, but of course once you do have these quantitative risk assessment available, you can link this or monitorize this and evaluate this. There are some numbers available, but this is not my field. I wouldn't like to comment on this.
Okay. Could you comment on anything? Well, how does the future look? Do you think it will be noisier or more quiet?
Hopefully more quiet, because all this research is being done to influence policies, and we want to cut down the noise everywhere, in the streets, around airports, along railway lines. So this is the emphasis. But we have to realize that this is a slow-going process, and much more awareness rising is necessary, really, to get the politicians to react on this. Although they do already. There is this so-called Environmental Noise Directive, and one aspect of the Environmental Noise Directive is that communities should make action plans to reduce noise, and they are actually doing this. There are possibilities building up sound barriers, having more quiet road surfaces, speed reduction. These are some instruments of how this can be achieved.
So what kind of research are you working on right now, as we speak?
Well, I'm more or less at the end of my reached the end of my career. I still have 2 studies on the relationship between road traffic noise and high blood pressure, which I'm going to analyze and which I'm hopefully will be able to publish within the near future. The new thing for me is that for the first time I will be able to account the associations for air pollutants, because the previous studies, the older ones, they were not looking at air pollution, and in these studies I do have air pollution data as well, so I'll be able to look at the combined effect and hopefully disentangle noise from air pollution.
Great. Look forward to reading about your results then.
Thank you very much.
Hopefully see you soon as well.
Yeah.
Thank you.
Thanks.